immunological things next. There's a whole bunch of cells. I spent probably a month reviewing these things, and trust me, I still don't know the whole complex cascade of what's going on. There have been several cells that have been identified specifically with MS. B cells, number one. There's no real good animal model. There's a close animal model, the EAE, or the experimental allergic encephalomyelitis. Okay. I think I forgot my false teeth glue today, so forgive me. B cells, the concentration of B cells, correlates with the rate of progression of MS. So the higher the B cell count, the faster you are going to progress. And B cells not only work through just presenting for antibody production. In MS patients, it's found it induces cytokine production, effector T cell activation, induction of regulatory T cells. Now, none of this is going to make any difference to you right now, but stay with me if you can, because we're going to get to the end where there's some studies that this stuff is really, really important. T cells. These are T helper cells. It's been shown, and there's a whole bunch of different types of these things, okay, and we don't have to memorize them unless you're in pharmacy school or medical school or something. Other than that, they don't really matter to us. But there is a normal concentration of T1, T2 cells. There's a normal concentration. With multiple sclerosis, there's an aberrant T cell response. What happens is that there are more T1 cells or Th1 cells than there are Th2 cells. Now, what does that matter? Well, Th1 is the inflammatory part of the process. Okay, that causes inflammation. Sclerosis is a inflammatory process. So we got a clue here. We're starting down a path. The Th2, which lowers or goes down, okay, is the thing that really fights that inflammatory process by regulating the concentration. Now, the interesting thing is if you look at some of the studies out of California on the pregnancies, okay, when you are pregnant, your Th1 cells are lower than normal so that you don't fight the fetus. Interesting. You also, it's been found, that people who are pregnant don't have exacerbations or progressions. It isn't until after they've had the baby that these things start. As a matter of fact, I don't know how many times I've heard from people, young ladies, 25 to 30, who say, well, I had no idea I had MS until after I had the baby. And then I just thought, well, it was because I have this screaming meanie, and I'm tired all the time. But it didn't go away. I went to the doctor, and guess what? He diagnosed me as having MS. There's another player. It's glutamate. And this is it's interesting how they found that glutamate is involved somehow with MS. There's this drug, riluzole, okay? They gave this to somebody, or they gave this to a bunch of different rats with EAE, and it upregulated, and they found more inflammatory process. So glutamate's involved here too. How? Well, we don't really know. But we do know that patients with or MS patients will have a higher level of glutamates. Now our old buddies, beta endorphins. There's a bunch of different beta endorphins. What can we say about beta endorphins? We can say that there is a cross-regulation between the neuroendocrine and the immune system, and we're going to find out in a couple minutes exactly what the story is there. There's an increased amount of beta endorphins in kids between 18 and 25. So what does that mean? Well, between 18 and 25, you're going to get a lot of these autoimmune things popping up. The beta endorphins, now it gets a little confusing here because the beta endorphins are up when there's a inflammatory process going on. And we'll talk about that in real numbers. But the beta endorphins skew or push the Th1 to Th2 shift. At EAE, or with the EAE model, there's an increase at peak of disease. Okay, there's more endorphins when they're going through this inflammatory process than when they're not. Why? It is presumed that the high levels are aimed at downregulating the inflammatory process. Okay, so you have an inflammatory process that's going on. Your beta endorphins increase, and when they get to a point, then the inflammatory process decreases. Okay? So that's beta endorphins. So we have a bunch of different things that are involved here. Now, standard of care. This is really interesting, standard of care. You hear that the way they diagnose MS is by eliminating everything else. Well, there is actually an article, actually it's more than an article, it's about 160 pages, the differential diagnosis of suspected MS, a consensus report, Miller, and it was done by an MS group. Okay, and basically what they're saying is that if you can't find, now this might be a little pushing it, if there is no other diagnosis, it's probably MS. There are 79 different red flags. That red flag thing is if there is a red flag, then you probably don't have MS, you probably have something else. So there's a list of things that you might have, okay, and that you have to exclude before you get to MS. And there's a strong, and this is quoting from this article, okay, there's a strong evidence base is lacking. So we really don't know. There are two criteria. There's a McDonald criteria with one which will include and one which will exclude MS. So next thing you have to do is you have to decide to treat the disease. Well, there's three things that you can do. One, you can reduce the biological activity, which means that you attack the active disease, the thing that's going on right now. Okay. You can also treat the symptomatic, or treat symptomatically, you know, your baclofens, your things for urinary incontinence. You can treat that way, or you can repair the damage. Okay, there's only three things that you can do. Okay, you can reduce the process that's going on, you can treat the symptoms that are going on, or you can fix it. And that's true in all medicine, not just MS, but this is the criteria for treatment. Now, let's evaluate the treatment that we have for MS. The benefits are modest. Again, I refer you to my students, and the first 2 weeks of their rotation with me, all they do is MS drugs. Why is that? Because at the University of Florida, which is a top 10 pharmacy school in the nation, Nova University, which is a private, sort of midstream, Florida A&M, which is a school that graduates pharmacists in Florida, Palm Beach Atlantic, which is a brand new school. Not one of those pharmacy schools teaches them anything about MS. Pharmacy schools, not one, not even Florida, and I'm a Gator, teaches them anything about MS. They come in and they, you know, what's MS? People don't know.